The myth about women being the root causes of infertility is changing with the time because of the awareness that has come in. Before, when everything was in the closet, men thought that the problem was women's. A man could go to the hospital and tell the doctor that I have brought my wife for investigation. And certainly the doctor would break the silence and say that the investigation should be for both of you. So with the advancement that we have right now in Uganda, men are becoming aware of their problem of fertility because the statistics say that it is a 50-50 cause of infertility, at least in our experience in Uganda.
What have you found to be the cause of infertility, and how do you assist in that regard?
Infertility comes about as a result of a gynecological condition. Women or girls suffer from transmitted diseases which are not treated in time. Then there are those induced abortions which are done crudely, and later on they result into the malformation of the reproductive organs. The non-communicable diseases like fibroids especially, which have resulted in operations that have gone wrong, has also been a major cause of infertility. Mm-hmm. On the side of tubal obstruction, which may have been caused by infectious disease, the treatment that has been ongoing aggravates the problem. Also, on the side of the men, mm-hmm. where they have suffered the same problem of, let's say, infectious disease.
At your support center, when you're trying to assist families with infertility, on a cultural level, maybe on other levels, what challenges do you face?
First of all, the mere mentioning that I have an infertility problem, it is a kind of taboo in our society. How can you speak about such a thing? People would wonder whether there is something wrong with you to speak publicly that I have an infertility problem, to bring out your mind and to speak what is on your mind and to seek for other people. So that secrecy, that inability to speak is the first major challenge. And of course, that started with women. When it goes to men, it was a complete close down, that they could not accept that there is an infertility problem on the male side.
Would you be able to give one or two recommendations that you can give to organizations that are doing the same work you're doing, perhaps that are just starting to help families? What would you recommend them to do, especially in your region?
Maybe I would like to share that I have helped organizations to start. One is called Hope Fertility Support Center, Kenya. And I have also built other networks on the African region, like in Zimbabwe, in Ghana. And we are also working with other friends in Israel. So we have a patient's charter that we share amongst ourselves that has what we believe in. But the major issue is to break the silence, be able to have the courage to speak out, because if you don't speak, no one will ever know. Then you need to have partnership with the health providers, with institutions that address health. For example, if you're in a village community, you you create your support group, your patient support group, and then you attach to the health facility.